Malaria and Travel, written by Dr. S. O. Goel, MBBS, Muleno Asad Medical College, Delhi, MD Medicine, USA. Disclaimer. At no time I am trying to become a doctor or MD physician. My whole purpose from these books or series of books on malaria is to provide a big picture about malaria in a very simple language and several other languages. Again, my disclaimer is that I am not a doctor. I am just giving you an insight so that you can use this medical knowledge to make wise decisions. Please choose wisely, but to choose wisely, you got to have the basic knowledge. Being a physician with 40 years of experience, medical knowledge part is easy for me, but to put it out for you in a simple language and multiple languages is surely a challenge for me and for our team. Chapter 1. What is Plasmodium falciparum? Plasmodium falciparum is a protozoan parasite that causes an infectious disease known as malaria. Plasmodium falciparum is the most severe strain of malaria species, correlated with almost every malarial death, and is dangerous if we are affected. Plasmodium falciparum is most dangerous of the 4 malaria parasites that infect humans, destroying red blood cells in the liver. It digests a cell's hemoglobin, multiples inside the point of rupturing the cell, and rapidly spreads a new generation of infection. Of all the major parasites, Plasmodium falciparum is the most dangerous. There was a time when Plasmodium falciparum was mainly found in Africa, and it was not there in India back in 1970s and 1980s when we grew up and went to medical college. Today, Plasmodium falciparum is very prevalent in India. Today, in almost all the advanced Western countries, malaria is completely eradicated. If people suffer from malaria, it is because people who travel to countries like India and Africa and other countries where malaria is not completely eradicated. Almost all the time, treatment is available only in hospitals as community doctors are not used to treating malaria. Traveling from all the Western countries to India and Africa has increased remarkably. However, there are preventive medicines available across the globe. There are 3 different medications available to prevent malaria as we travel to India or Africa, which is discussed in the next chapter. Chapter 2. Disclaimer. I must mention the disclaimer that all these are prescription medications and should be undertaken at the recommendation of the physician. This is for your knowledge that this is for you to help you decide which medicine you want to take. The first medicine is ATOVAQUONE PROGUANIL. It is an anti-malarial agent. It is used to prevent and to treat malaria infections. The lowest good RX price for the most common version of ATOVAQUONE PROGUANIL is around $67.4, 51% of the average retail price of $138.46. The quantity to be taken is 250 mg per 100 mg, and it comes in the combination and to be taken daily. It is very well tolerated medicine without any common side effects. Pediatric tablets are also available and may be more convenient to take them. This tends to be more expensive than some of the other options. Insurance will also be covered if prescribed by MD. Think about it before seeing doctor. How often to take this medicine? Start 1 to 2 days prior to entering malaria endemic area and continue throughout the stay and for 7 days after returning. This medicine is good for shorter trips as you only must take the medicine for 7 days after traveling rather than 4 weeks. Chapter 3. Differences between ATOVAQUONE PROGUANIL and MALARONE. Simply put, there are no differences. MALARONE is a brand name, whereas ATOVAQUONE PROGUANIL is a generic name of the combination of medicines used to produce both versions of the anti-malarial medicines. In recent years, the exclusive license for the sale of ATOVAQUONE as MALARONE expired, and the medication could be produced by other pharmaceutical manufacturers under the generic names. Therefore, we often refer to the combination of ATOVAQUONE as generic MALARONE, same ingredients with no brand name. Chapter 4. Disclaimer. I must mention the disclaimer that all these are prescription medications and should be undertaken at the recommendation of the physician. This is for your knowledge and this is for you to help you decide which medicine you want. Mefloquine. Mefloquine is a second medicine and is used to treat and prevent malaria infections. The generic name is Larium. How long to take this medicine? The quantity to be taken is 250 mg and should be taken once a week, starting 1 to 2 weeks before arrival in the endemic area and should be continued during the travel to endemic area. This should be continued for 4 weeks after leaving endemic area. This medicine can also be taken weekly if preferred. This is a good choice for long trips as it can be taken weekly once. It is not good choice for last minute travelers because drug needs to be started at least 2 weeks prior to travel. Mefloquine can be prescribed to adults and children of all ages. It can also be safely taken by pregnant women during all trimesters of pregnancy and nursing mothers. Chapter 5. Disclaimer. I must mention the disclaimer that all these are prescription medications and should be undertaken at the recommendation of the physician. This is for your knowledge and this is for you to help you decide which medicine you want. Doxycycline. Doxycycline is a third medicine for preventing malaria. It is one of the tetracyclines. How often to take this medicine? The quantity to be taken is 100 mg daily. This medicine should be orally consumed. This should be taken 1 or 2 days prior to travel to endemic area and to be continued during the travel and to be taken for 4 weeks after leaving the endemic area. Doxycycline is a well-known medicine. It is not very costly and it has no side effects. Good for last-minute travelers because the drug is started 1 to 2 days before traveling to an area where malaria transmission occurs. This medicine tends to be the least expensive anti-malarial medicine. It is also most commonly medicine used to treat acne. If doxycycline is already taken to treat acne, then they do not have to take additional medicine. Doxycycline also can prevent some additional infections, so they may be preferred by people planning for hiking, camping and swimming in fresh water. It cannot be used by pregnant women and children below 8 years of old. Think about it before saying doctor. Any antibiotic can always cause vaginal yeast infections. Yeast infection but can be treated easily. Also, tetracyclines do tend to make us sensitive to sun, so we need to avoid too much sun exposure to the sun. For more information, please visit www.ad15years.com. Thank you.